Every day, millions of people brush their teeth with complete confidence, believing toothpaste is strengthening and protecting their smile. But what if some toothpaste formulas are slowly wearing down the very enamel meant to defend your teeth from damage? This deeply unsettling is that this process happens silently, without pain in the beginning, showing only small visible changes that seem harmless at first, until one day the teeth become sensitive, weaker, and far more vulnerable than they were before. Researchers have started paying closer attention to how modern toothpaste interacts with enamel and gums, and the first visible warning sign is something many people have already seen in the mirror, but never realized could be a signal of deeper hidden damage. We are going to discuss these signs and effects in next minutes one by one. Enamel thinning effect is visible in yellow color despite regular toothpaste use. The change is so subtle that it is easy to ignore. Your teeth begin to look slightly more yellow, even though you brush every day, sometimes even more than once, believing you are protecting and whitening them. But instead, the opposite may quietly be happening. This yellowing does not always come from stains on the surface. It can come from beneath the surface, and that is what makes it so disturbing. Many modern toothpaste formulas contain abrasive cleaning particles designed to remove plaque and stains, but these particles do not distinguish between unwanted buildup and the protective enamel itself. Over months and years of daily brushing, this constant abrasion can slowly thin the enamel layer, wearing it down little by little without causing pain in the early stages. Enamel is the outer shield of your teeth. It is the strongest substance in the human body, but once it begins to thin, it cannot rebuild or repair itself. As this protective layer becomes thinner, the dentin underneath begins to show through, and dentin has a naturally darker yellow tone, which means the yellow color you see may not be a stain at all. It may be the inner structure of your tooth becoming exposed. This is why some people notice their teeth becoming more yellow over time despite consistent brushing, because the protective white layer is slowly being eroded away. According to the American Dental Association, enamel does not regenerate once it is lost, and preserving it is essential for long-term tooth strength and protection. What makes this even more alarming is that thinning enamel does not just change the color of your teeth, it also makes them weaker, more sensitive, and more vulnerable to future damage. This means the yellowing you see in the mirror may not just be a cosmetic issue. It may be an early visible warning sign that your teeth are losing their natural protection. And what makes this even more concerning is that this is only the beginning, because once enamel becomes thin, something far more uncomfortable may already be starting deep inside the tooth. Tooth sensitivity trigger. Have you ever felt a sudden sharp pain in your teeth the moment cold water, tea, or ice cream touches them? It happens instantly, without warning, like a small electric shock deep inside the tooth. Many people ignore this sensation, believing it is temporary or harmless. But this sudden sensitivity is often one of the earliest warning signs that your tooth's natural protective shield is weakening. The outer layer of your tooth, known as enamel, is the hardest substance in the human body, designed to protect the delicate inner nerve from temperature changes, bacteria, and physical damage. However, enamel can slowly wear down over time due to daily exposure to abrasive substances and chemical interactions. This process is gradual and invisible in the early stages, which is why most people do not realize it is happening. Beneath the enamel lies dentin, a softer layer filled with thousands of microscopic channels called dentinal tubules. These tiny pathways connect directly to the nerve center of the tooth. When enamel becomes thin, these pathways are exposed, allowing cold, heat, and even sweet foods to directly stimulate the nerve. This is what causes the sudden, sharp pain known as dentin hypersensitivity. Sensitivity is more than just temporary discomfort. It is a biological signal that the tooth's structural defense is weakening. Once dentin becomes exposed, bacteria can travel more easily into deeper layers of the tooth, increasing the risk of inflammation, infection, and long-term damage. Early stages may involve mild irritation, but over time, this can progress into serious conditions such as pulp inflammation, chronic pain, and even nerve damage that may require invasive treatments like root canals. According to Mayo Clinic, enamel erosion significantly increases the risk of tooth sensitivity and deeper structural vulnerability. What makes this especially concerning is that enamel does not regenerate naturally once it is lost. This means the protection your teeth once had cannot fully return, leaving them permanently more exposed to damage. And while sensitivity may seem like a small inconvenience at first, it often signals that deeper protective barriers are already weakening, and the next stage of damage may not affect just the tooth surface, but also the gums that support and protect your entire dental structure. Thirdly, gum recession. Have you ever looked in the mirror and felt like your teeth suddenly look longer than they used to, even though nothing else has changed? At first, it seems like a visual illusion, something easy to ignore, but this subtle change may actually be one of the clearest visible warning signs that your gums are slowly receding. Gum tissue is designed to act as a protective seal around the base of your teeth, shielding the sensitive root surfaces from bacteria, temperature, and physical damage. But when gums begin to pull upward, they expose parts of the tooth that were never meant to face the outside environment. This exposure does not happen overnight. It develops slowly, often as a result of repeated daily friction caused by aggressive brushing combined with abrasive toothpaste particles. Every time excessive force and abrasive compounds scrape along the gum line, microscopic damage can occur. Over months and years, this repeated stress can cause the gum tissue to gradually shrink and detach, exposing the fragile root underneath. This is especially dangerous is that the root surface does not have the same protective enamel layer as the crown of the tooth. It is softer, more vulnerable, and far more sensitive to damage. Once exposed, the root becomes an easy target for bacterial invasion, decay, and structural weakening. You may begin to notice increased sensitivity, small notches near the gum line, or a rough texture that was never there before. According to Cleveland Clinic, gum recession exposes tooth roots and significantly increases the risk of sensitivity, decay, and long-term tooth instability. This process also weakens the foundation that holds the tooth firmly in place. Over time, this can lead to loosening, structural compromise, and a higher risk of tooth loss if the underlying support continues to deteriorate. What makes this even more alarming is that gum tissue, once lost, does not naturally grow back to its original position. And while longer-looking teeth may seem like a harmless cosmetic change, it may actually be a visible signal that the structural support system of your teeth is slowly weakening. And the final visible effect goes even deeper, directly affecting the strength and survival of the tooth itself. Lastly, microdamage effect or rough surface of teeth. Have you ever run your tongue across your teeth and noticed a rough edge that was never there before, or felt a tiny uneven surface that feels slightly different from the smooth enamel you remember? At first, it feels insignificant, easy to ignore, but this small change may be one of the earliest visible signs of microscopic enamel damage quietly developing on the surface of your teeth. Enamel is the strongest substance in the human body, but it is not indestructible. Every day, repeated exposure to abrasive toothpaste particles combined with mechanical brushing creates friction. This friction slowly weakens the tightly packed mineral structure that keeps enamel strong and smooth. Over time, this can create microscopic cracks so small they are invisible to the eye, but their impact is very real. These tiny cracks weaken the structural integrity of the tooth, making it more vulnerable to chipping, roughness, and gradual breakdown. This truly disturbing is that enamel cannot repair itself once it is damaged. Unlike skin or bone, enamel has no living cells. Once microscopic cracks begin to form, they can slowly expand under daily pressure from chewing, grinding, and temperature changes. You may begin to notice small chips appearing unexpectedly. Edges may feel sharper. Teeth may lose their natural smoothness and strength. According to Mark Burhen, author of the 8-Hour Sleep Paradox, protecting enamel is essential for long-term tooth stability because once enamel structure is compromised, the entire tooth becomes more vulnerable to decay, fractures, and permanent weakening. The most dangerous part is that this process happens silently. There is no immediate pain, no obvious warning in the early stages, but beneath the surface, structural damage may already be progressing. And by the time visible cracks, chips, or roughness appear, the protective armor of the tooth may already be permanently weakened. Information opened your eyes. Make sure to like and share this video so more people can recognize these early warning signs before the damage becomes irreversible.